Namaha. A warm welcome to all of you to today's presentation on research updates on Ayurveda dermatology. So, actually, this is not a very complicated topic, what I am going to convey to you. So, even an undergraduate student or a BMS doctor can understand how to record a case systematically and what are the things you need to consider, how a photography should be taken. These basic things regarding the research documentations are going to help. And few recent articles also I will update you at the end of this presentation. Okay. Okay. So in this presentation, actually, I am going to present regarding the research and documentation. What is the necessity of research especially in the field of Ayurveda dermatology? Dermatological photography, how a dermatological photography can be taken, basic guidelines for dermatological photography, and outcome measures, the selection of the most accurate outcome measure like the PASI scoring or the DLQI or plurality scale or VAS, whatever it may be. So how to select it and how it can be implemented, and regarding the existing knowledge regarding some publications in index journals. Okay, so these are the a short talk on research updates. Okay, coming to research and documentation. So, what is the necessity of a research? Because many of them you may be having the doubt that I'm a clinician, I'm sitting in an OPD setup, and treating the patients. I get good results, and why should I worry about this research and all? Research doesn't mean that it should be done in a big laboratory or a big clinical setup. Every time we see a patient, if you have a keen observation on the changes, what is happening in that particular patient, and if you systematically record it without omitting any part of your observation, it is obviously a research. In the West, there was a practice that there was a tradition that physician scientist. So generally, the medical science developed because of this concept only. This much of advancement happened in the field of medical science because of this concept only. Physician scientist. Basically, they all will be physician. At the same time, they will have or they will devote a particular time or their work amount of work for the research updates or doing the research in the field of the medicine. Okay, so that is in this view in India also. Few thoughts also started in the past few years from the Transdisciplinary University of situated at Bangalore and also Pune University, the CCAH team. They have started a fellowship program called Vaidya Scientist. A Vaidya should be also a scientist. But this is a big thing, what's happening in the background. But for a clinician, of course, he should be a researcher also. Because the entire world is looking into Ayurveda, what is happening in Ayurveda, how effectively it can manage various conditions. And there are a lot of claims happening in various parts of the country regarding different ailments and their success stories. But none of them are systematically documented and presented in front of the world and in front of the scientific community. So, as I told in the first, I am a clinician, I treat patients, I have many success stories. Why you are hesitating to publish or present these success stories in front of the scientific community or in front of the public? So that is why the research part comes very important. That also, especially the systematic documentation, scientific documentation of the cases comes to importance. Apart from that, there are a lot of possibilities of doing inter or transdisciplinary research because many of our drugs are acting in the body and we don't know how they are acting in terms of modern physiology or the pharmacognosy or pharmacokinetics, whatever it may be, the methods. We know how the drug is acting based on our dosha theory. But this same dosha theory cannot be translated into a common man or a scientist in the other part. For that, we need to understand the mechanistic action of each and every treatment which gives result in the body. So that is why the transdisciplinary research or interdisciplinary research is very essential, and there are many such attempts are made in various parts of the country, like reverse pharmacology. Reverse pharmacology is another area of research where from the clinical side it comes to the research side. So this is very much suitable for Ayurveda. Generally, in the modern medicine, what happens is it starts from the laboratory, and which the end user is the patient and in the clinic. Right? A drug is developed in the laboratory based on the molecular level or understanding the molecular pathway, etc. Then the drug will be tested in the animals, and drug will be tested for the side effects and the toxicity, and drug will be tested in the patients. And finally, the drug gets approval and comes to the market and in the clinics. But in Ayurveda, the medicines what we are using in our day-to-day practice is time tested. Since time immemorial, we are using these medications and need not to undergo any of these toxicity or animal studies. So we are seeing the result in the patient in the clinical setting. So from there, we have to come back to the molecular, how this drug is acting in the body. So a lot of scope is there for the research in Ayurveda, especially to the dermatological condition. Why dermatology? Because when we document a dermatological condition, it is somewhat easier than any other diseases, because the first evidence itself is a photograph. So that is why I am giving a detailed slide on dermatological photography also, because no other disease can be proven whether it is treated and what successful. Because, for example, if a patient is having some psychiatric problem, unless and until the patient himself give consent or give a testimony, then only we can say that he is out of the problem. Or else we need to go for many other tools like mental status examination, etc., etc. But in a dermatological condition, take the picture before treatment and take the picture after treatment. That itself is a very strong evidence for the success of that treatment. That is why the documentation is very essential. Documentation is very essential. Understanding the dosha involved, understanding the patyas, understanding the nidanas, and recording the nidanas of each and every patient. Systematically record this. So I will show you how a case performer should be, especially formulated for the dermatological. Apart from that, there are clinical trials. Clinical trials, for that we need to ethical approval, ethical permission from the ethical committee, and if it is animal studies, it should be animal approval should be there, animal ethical committee. Then after that, we have to go for CTRA, clinical trials registry of India. In that, we have to register the trial. Then only we can start the clinical trial, and it's a very huge process. There comes our hero, that is case reports and case series. This doesn't need any of these approvals from any of these bodies. Only thing we should get a proper written consent from the subject or the patient whom we treated. So this can be done in each and every clinic, and there are a lot of possibilities for publication also of these case reports, because in the evidence pyramid of research evidence pyramid, the case reports are on the bottom side, and meta-analysis comes on the top. Even though it is on the lower part, in Ayurveda, this case reports plays very important. There comes another concept, real world evidence. Now you may be very much aware regarding the data science or the big data analysis and all. For example, when you use your smartphone, the Google gives Android updates every monthly or bi-monthly or every 3 months or 4 months, whatever it may be. From there are Oreo, Nougat, like that, different names, updates are coming, new versions are coming. How they are understanding the problems of the end user, that is you are using the Android phone. How they are understanding what the customer requires. Based on these, each and every time when you use, the Google collect the statistics from each and every person, and from the entire world, they collect a huge number of statistics. When you use a single click on the screen, it becomes open, or whether we have to pinch and drag it to make it big, whatever it may be, the customization the Google does based on these end user requests. And they analyze the huge number of data, and from there they come into a solid conclusion that the user requires this feature. This feature is very much disappointing the end user. Like that, they can reach into a very solid conclusion based on the huge number of data. This is called analysis of big data. Even the predictions in the elections, the predictions which is happening in the election, they say that UDF will get this much of vote and LDF will get, Congress will get, Communist will get this much of vote, and there is chances of coming the Narendra Modi government again and again. So these kind of predictions are mainly done based on the big data analysis. So similarly, the real world evidences are very much important. That means whenever you treat a dermatological condition in your clinic or in your hospital, you just record it. Whatever it may be the case, however, how you are treating it is immaterial. Only thing is, you should have a detailed recording of its dosha involved, nidanas, and its samtrapti and aggravation factors, and the timeline, and the medications what you are given, how much frequency they have visited, the follow-up history, and the outcome measures. How you are saying this is getting improved, how you are observing it is getting improved or it is getting cured. All these things, if you record, for example, if you record a Vicharchika this time, tomorrow another Kitipa case came, you recorded that. Next day came again one more Vicharchika. Like that, you record each and every case for 5 years or 6 years. By the end of that time, you may be having a huge number of data of various skin conditions in your clinic. So, if you analyze this and you can formulate a particular treatment protocol for that particular disease. For Vicharchika, these are the treatment which give good result. So this is called real world evidence. And if the analysis of this real world evidence is really a challenging task, for that we need to have the support from some data scientists. But the conclusions drawn from this analysis of this big data and real world evidence is very much solid, and it is the future research which is going to happen in the medical field. Okay, so just I want to introduce this terminology, real world evidence, that's all. So that's why I kept this here. So I'm going to the case reports. As you know, in the previous class also, I have told some of my publications from our department regarding various skin conditions. And a good case reporting demands a clear focus to make explicit to the audience why a particular observation is important in the context of existing knowledge. So this should be the question when you write a case report for the purpose of publication. How this case report is going to improve the existing knowledge for the sake of patient. So that is very important. So it's not as simple as writing in a case sheet in the hospitals, like when you have done your Ayurvedic graduation or post-graduation. So just recording Prakriti, Madhyama, Avara Madhyama, just simply Pravara Madhyama or Absandhyas. It's not that simple. So it cannot be presented in that form also. So there are certain guidelines given by the carestatement.org. They are the authority for giving guidelines for the case reports. So if you go to the care guidelines site, so this is the, I think you can see the website, care case report guidelines. So there are checklists they have given. They have given some sample case reports, and for others some guidelines they have given. They have given the guidelines for the written consent, how to take a written consent, all those things they have given already here. So you should go through before you write a case report. So here one more addition they have given in the last year, that is the care writer. So they made it somewhat easy for the scholars to write a case report online itself. They can add the details and they can edit whenever they get time. So none of the informations will be omitted or missed out. So that is why they have started the care writer also nowadays. So care writer is the another addition by the carestatement.org. So like this, you can get a care writer. See, so once you log in, you need to log into the care writer platform, and in the care writer, you can add a new case. So for example, I am adding dermatology and create case. Okay, so keywords you can add, case report like Titiba, like psoriasis, etc. Keywords I have added. And here on the right hand side, you can see title and keyword. Then below that, authors, you can add the authors of that particular case report. Then introduction. So what introduction you are going to read, you can put here. Then these are the basic titles which is required to publish a case report, like visit summaries, narratives and diagnostics, patient perspectives, discussion on the treatment, then conclusions. And then you can give the acknowledgement, references, and if any attachments like photographs, etc., also can be given here. So this is a very beautiful platform where you can add various case sheets. So now in my dashboard, you can see there are 2 case reports are already there. So I am working on that. One is ankylosing spondylitis in Ayurveda, and another is Bacterial syndrome in Ayurveda. 2 case reports I am working. So whenever I get time, I will edit them. Whenever I get the information regarding the follow-up visit, I will add them. And finally, I can easily publish this article to the in the prescribed format. Okay. So in the case report, as we seen, there should be a case presentation should be there, an introduction should be there. Introduction, just give a brief introduction regarding the disease what you have treated and how you have came into the diagnosis and all. And after that, you should give the case presentation. What is the present case you are going to present? And it should be anonymous. The name should not be revealed. Patient identity should not be revealed at any point of time of the publication. And after that, you have to give the diagnostic details. And after that, the visit summaries. So how many visits they have visited you. Then in our case reports, we can give the treatments into Shodhana and Shamana, split the treatment into Shodhana and Shamana. In Shamana, what are the Shamana modalities you have adopted? What are the Shodhana modalities you have adopted? How many times? How many visits you have adopted this? Then give a timeline, brief timeline of the, I will show the example for the timeline also. A brief timeline on regarding the case report also you can give details. And after that, the visit summaries. So how many visits they have visited you. Then in our case reports, we can give the treatments into Shodhana and Shamana, split the treatment into Shodhana and Shamana. In Shamana, what are the Shamana modalities you have adopted? What are the Shodhana modalities you have adopted? How many times? How many visits you have adopted this? Then give a timeline, brief timeline of the, I will show the example for the timeline also. A brief timeline on regarding the case report also you can give. And after that, Discussion part is very much important in each and every case report. Discussion means how the particular drug has acted on the body. So based on your dosha interpretation, you can write. Apart from that, based on the ingredients of that particular drug or that particular procedure, the how this have influenced the pathology of that particular disease in the modern aspect, and the molecular structure or the alkaloid which is present in that particular herb, how it is helped to the samprapti vigana or breaking the pathology. These things we should discuss in the discussion part. At the end, we have to give a patient perspective. The in-patient words, how he felt after this treatment. What is the observation made by the patient during this treatment? That also can be given. And at the end, there should be a conclusion. Conclusion means how this particular case report enrich the existing knowledge and what you learn from this particular case. This thing should be given in the conclusion. And at the end, the necessary reference also should be reported. Okay. So, there are a lot of journals are available for the publication, but the main problem is majority of the Indian journals which publish these Ayurveda articles are predatory journals. Predatory journals in the sense they don't have any proper identity or indexing. So obviously, when you try to publish an article in a journal, you should check their validity, whether they are indexed either in Scopus or in PubMed or in Web of Science. These three indexing platforms are very important. Now, in the last 2 months back, in Amrita School of Ayurveda, we started one more initiative, that is Ayur Case Preprints or Ayur Case Archive. Okay, Ayur Case Archive is a preprint platform where the articles will be peer reviewed only by the editor, or editorial review will be done, and you can easily publish this. But it should be in the care format, as it follows the care guidelines, and it should have a written consent, and it should be neatly written with somewhat good English. If it is the criteria, if it fulfills these criteria, it can be easily published in the preprint server of this Amrita School of Ayurveda, like Ayur Case Archive. So you can log into the Case Archive, and there are guidelines for the submissions are given, and how it should be published. All those details are available, and the consent forms you can download from the server itself, and you can submit it. So within 10-15 days, you can publish a case report in this server. The importance of this server is once you publish in this, it can be available in the internet. But when we go for a index journal, it is a long process. There are different levels of peer reviewing will be happen. Peer review in the sense, the same case reports will be sent to some experts in the field, and they will put their remarks on the particular case reports. They will ask us to correct some of the areas, and they can reject or accept the case reports. If they accept conditionally, they will suggest for some reviews and revisions in the case reports. And after 2 or 3 such reviews and revisions, finally, maybe it may take 3 to 1 year, 3 months to 1 year, it may take to publish a case report in the index journal. Okay, so there comes the importance of this Ayur Case Archive. It's a preprint server where easily you can publish, and still you have the opportunity to publish this article in a index journal also later also. Okay, because many of the index journal accept, even though it is published in the preprint server. Preprint server is a storage place which can be viewed in the internet before it gets published in the complete form. Okay, so in the so once you don't regret that once you publish in the preprint, later you can submit this same article to some of the index journals, and you can undergo the review process and finally get it published in an index journal. Okay, so that's also possible. this review process is very important because this modifies our writing skill and our perspective to that particular disease. Whenever you write, you feel that whatever you have written is correct according to you, and you will be damn confident regarding the matter what you have written. But when it is sent to some other person, he can identify any number of mistakes in that particular document. So they will not note it down and return back to you to correct it. Okay. So if it is many mistakes are there, they will reject the paper. If a minimum number of mistakes are there, they will ask you to revise it and resubmit. So like that, the correction and resubmission makes your skill to publish is also increased. Okay. So that is why these case reports are very important. So if you publish these kind of case reports, it will enrich the acceptability, enrich the knowledge of the Ayurveda in the scientific community. At the same time, it will improve the acceptability of the Ayurveda even in the outside India also. Okay, so that is why you can go through this carestatement.org, and also you can utilize the facility of this care writer. In the carestatement.org itself, you can see in the first paragraph itself, you can see the care writer. Just click that, so it will open the care writer page. Okay, so here launch care writer. Then you have to log in. My account is already logged in, that's why it shows the dashboard and all. Otherwise, it will show as a sign out. It will show it like this. Just you have to log in with your Google ID itself. You can easily log into it. So try to have a habit of recording the case reports time to time. With your mobile phone itself, you can log into Care Writer and put the information, whatever you have collected from the patient, directly to the Care Writer. Okay. So this makes your recording very simple and easy. And once you have a format of as per the guidelines of the care report, you can publish it in the preprint server, or you can send it for a index journal for the publication. Or first step, you can publish it in preprint server, and later, after the publication in the preprint server, you can send it to the index journal for the publication. Okay, so this is very important. Okay, so coming back to the presentation, so that similarly we can publish the case series also. For example, if you have treated a psoriasis patient in your clinic, or one patient came, you have got good result, and another patient came, there was some relapse of the condition was occurred, and third patient came, you find good result. So if you record like that 2, 3 or 4, 5 cases continuously and then the follow-up properly, you can publish it as a case series. It's also higher value than a single case report. Case series can be, you can accumulate data from all these 5 cases, and you can reach into a conclusion how these cases are responded to your treatment, even though you have adopted various medications. Like that, some conclusions, some discussions you can do, and you can publish. So the case series also very important. Okay. So coming to the dermatological photography. Okay. So you can go through the paper also. There are many papers are published in the PubMed. You can, if you just search clinical photography in dermatology, there are many papers you will get, and in the PubMed also. So the main tool what we are using in the dermatology is the photographs for the outcome measure. Okay, so it is nowadays it's everybody is having the smartphones, having good camera focus, camera pixel and all. So it is very easy nowadays to record the photographs of the patient. Okay, so you can store it in your phone itself, or you can transfer it later to your Google Photos, or you can transfer it to your iPhone, iCloud also if you have Apple phones, or else you can transfer it to your desktop computer. Okay, whatever it may be. Systematically store before treatment, after follow-up, each and every step of the patient. Okay, because this is very much important when it goes for a publication. In dermatology, the photographs plays or is considered as one of the major tools for the assessment. As some, I will give some basic guidelines how to take a proper clinical photography in dermatology using your simple smartphone. Ensure that a written consent is obtained from the patient prior to photography. This is very important. For publication of any case reports, a written consent is very important. But if you are taking the photograph of a patient, you need a separate consent for taking the photography. In that, it will be stated like that: for the clinical and academic purpose and for the purpose of publication, I am giving consent to take my photograph. Like that, some sentence. A standard format, you can get it from the Google. Okay, if you just search photography consent for the dermatological conditions, you can get the PDF download, you can get a free downloads. Okay, so use that standard formats for the consent form. So ensure a written consent obtained from the patient prior to photograph. So that is why I, in the previous class, when I explained about the different case reports in clinical condition which I treated, and first slide itself I told that whatever pictures are presented in this presentation are after obtaining a written consent from the patients, because without patient's consent we should not publish any of the photographs of the patient. We say it is crime, okay, and ethically it is not correct also. Apart from that, if you are taking the photograph of face, we should make the mask the eyes and all to make it anonymous. So that is also very important. So this becomes more important for images of the face, tattoos, etc., where the identity is compromised. Maintain a distraction-free and consistent background. This is also very important. So in your clinic, when you take a photograph, at the same place, same background, you try to take the photograph each and every time. Each and every time. That is very important. Once you have taken while sitting in the chair, once you ask the patient to stand behind the wall, in front of the wall, and you have kept the wall as background. So like that, the background should not be different. It will be distracting and it will not give a clear picture about that photograph. So that is why a distraction-free, consistent background should be there. A plain light blue or green background is considered ideal for taking the photographs, because taking pictures with a smartphone is so easy. This point is often neglected. So because the handphone is in your hand, so by sitting itself, you can focus on the patient's affected area and take the pictures. But if you have a actual camera which is kept in tripod, you will ask the patient to come in front of the camera to that particular background. Then only you will click the photograph. But with the smartphones, because of its user friendliness, you will take in many ways. So that is why keep it in mind that there should be consistent background while taking the photograph. Take multiple images whenever possible, because this is very important. Because once you take the photograph and you send back the patient to his home, it's not easy to bring him back if the photo is not clear or it is blurred out. So that is why we should take multiple images whenever possible, and poor images can be always deleted later. But don't judge a photograph in your smartphone, because in the smartphone screen, many of the photographs will be misleading. It will not give a clear picture. So before deleting the photographs, you should transfer these photographs into the laptop or a desktop. Then after seeing it in the desktop or in the laptop, then only you have to delete, whether it is out of focus or blurred or having low light quality, etc. Okay, because in smartphone screen, all photographs will look beautiful. Okay, so here these two pictures you can see. One is taken in the Nikon camera, and another is taken in the BlackBerry Z10 smartphone camera, 8 megapixel. Okay, the first picture is taken in the BlackBerry camera, and the another picture is taken in the Nikon Coolpix 4MP camera. Okay, see, in the BlackBerry smartphone camera, the photograph is slightly different than the actual photograph of the patient, which is in the B, taken in a normal camera. These cheeks and the mouth part is slightly differently focused. Okay, so that is why always take the photograph and see it in your computer. Then only we have to select which is good and discard which is bad. The true quality of the image can only be appreciated after the image is transferred to a computer and viewed on the computer monitor. Also, capture image from different angles. This is very important. But you should be, you should know that from which angle you have taken the photograph. That is very important, because in the first visit, before treatment, you have taken the photograph in a particular angle, and in the follow-up visit or the after treatment, you have taken the same photograph from different angles. Will not serve the purpose. In the second time also, you have to take the photograph in the same angle. Then only it will be resemble, or it will look similar to the previous photograph. Otherwise, the readers or the reviewers will think that you have made some malpractice in your photograph. Okay, so that is why the capturing the images in different angles in a standard background and multiple photographs is very important. A minimum of 2 views are recommended. The angles, regarding the angles, minimum 2 angles or the views should be recommended. From a distance showing the lesion in relation to the whole body or to the some of the anatomical landmarks, and a close-up view showing the morphology of individual lesions. Lighting and position regarding the photograph. Lighting and position of the patients are the most important concerns in terms of ensuring consistency of images for the follow-up and documentation process. Some of the articles say that using flash is better to avoid the blurring of images when you use with smartphones. But the problem with this using the flash or auto flash, it will give a different appearance to the skin lesions. Okay, so that is why, in my opinion, whenever you take a dermatological photograph, it should be taken in daylight. It should be taken in daylight where a clear daylight is falling. In that particular area, you take the photograph. This will give a very beautiful and clear picture of the that particular lesion. A dedicated area in clinic with the fixed lighting conditions is ideal for clinical photography. So in West, they suggest like this, but using flash is not always advised. Ensure the proper focus is achieved and the lesion in question is properly focused. This also we should consider before we take the photograph. So nowadays in the cameras, there are autofocus option is there, or else you can touch the screen to the lesion which is visible in the screen. Just touch on that lesion in the screen so that it will focus to that particular area. That also possible nowadays. Touch focus is possible. It is important to remember that a blurred photograph is of no value in clinical photography. Overexposed or blurred, whatever it may be, doesn't have any value in the clinical photography. So that is why a properly focused, without blurred and properly exposed photography is very important. Okay, so otherwise we may repent at the end if you are not checking it regularly. At the end, when you getting ready for publication, you may not have the proper photograph of that particular case. You may lose that. Okay, so apart from that, there are few apps are also available in the App Store, in the Play Store. Like Clinic Pics is an app which we found to be very useful for storing the and organizing clinical photographs, and primarily intended for the physicians. Clinipics. And another app is AppvoRx. AppvoRx is another useful application for the clinical photography with the special features such as anatomy cataloging, integration with electronic medical record, etc. And PixSafe is another app for secure sharing of medical image between the doctors. Okay. Similarly, many editing apps also available, or simply you can store these photographs in Google Photos, but privacy will not be ensured, or you can put it in the some cloud storage in the Google Drive, etc. Okay, so this way you can ensure a good clinical photography, or create the evidence for the various dermatological conditions using a good photograph. And coming to the another topic of today's presentation is outcome measures. How effectively we can select the outcome measures like passive scoring, DLQA, pruritus scale. I will show a few examples like passive DLQA, pruritus scale, etc. And I will show a case recording performer also. So let us go first to the case recording performer, because this is very important to systematically gather the information from the patients. Okay, if you take a white paper like this, and start to record in this, it will not be systematically recorded. You may omit some of the knowledge, some of the information, or you may enter some of the information which are not necessary for our inputs, getting some inputs from that particular disease. So that is why always have a structured case proforma for recording the whatever may be the condition. Okay, so I will show a case report which is formulated in our department for one of the dermatological condition. So in the demographic data will be collected like age, sex, height, weight, and education, religion, and marital status. Some of these informations are very important and gives input towards the understanding the nidana of the patient, and socio-economical background of the patient, and how his diet may be, the diet patterns, the climatic condition of the patients. All these information we can get it from these demographic data. So based on this demographic data, we can interpret the condition later. That is also possible. Okay. So biopsy report is not mandatory because it takes a lot of extra precautions. But in clinic, it will not be possible. Otherwise, you may have to send it to a dermatologist. With his approval only, you can go for, you can send the patient for the biopsy. But in our hospital, we collect the samples for the biopsy and we will send it to the lab directly. Okay. But in clinic, it will not be possible. So leave it. The presenting complaints. So symptoms you have to enlist. What are the symptoms are generally seen coming in your clinic? So this is very much particular to the psoriasis we have collected here, like itching of skin, burning sensation, scaly plates of the skin, hospital sign, pain, fissures and cracks of skin, discharge and type of discharge, etc., etc. So site, duration, etc. will be recorded. And coming to the medical history, so any relevant medical history is there. There should be enough space to record that. Then coming to the personal history, like Viruddhahara, like diet, vegetarian, mixed, Rasapradhanita, what kind of ahara predominantly he takes. Then frequency of apatya sevana, because in Kollam, where Amrita School of Ayurveda is situated, and because it is lies in the coastal belt, so majority of the skin patients come to my OPD. I see many common nidanas like excessive intake of fish, or fish with the milk, fish with the curd, etc. It's common nidana in many of the conditions. Okay, like that we can identify some of the common nidanas or frequently taken food articles in their routine line. Then you can identify the Agni, bowels, Kosta assessment. This is very important. If at all you are going for any of the Shodhana procedures, the Kosta assessment is very important. Otherwise also Kosta assessment is very important. because in Kushta Chikitsa, many of the Aushadas we prescribe are having some Anulomana action or Samsana or Vedana action, like Patola Kadronyadi or Patola Muladi or Manivadragulam, whatever it may be. For Nitya Virecana purpose, you are prescribing. To fix the dose of that particular Aushada, we need to understand the Koshta. That is also very important. Then sleep pattern, allergic habits, menstruation, etc. Okay. And coming to Vikriti Parisha, so Aharaja, Viharaja, intake, what are the Viharas he as Nidana Sevana he takes. Then Kushta Purva Rupa Lakshanas, that also we record. The Asvedam, Ati Slakshanam, Distodam, Pariharshata, Swayatu, Gauravam, etc. etc. And Kushta Lakshanas according to Dosha. So, which already I give a detailed explanation regarding the Doshanusara Lakshana of Kushta according to Acharya Charaka. Ruksha, Stosha, Shula, Sankocha, Ayama, or Vata. Then Daha, Raga, Parisrava, Paka, Visragandha, Kleda, etc. for Pitta. Then Shweta, Shaitya, Kandu, Stairya, Utseda, Gaurava, etc. etc. Lakshanas for the Kapha. So, like that, the Doshanusara Lakshanas also we can record. So, these things will, if you systematically record, you can easily reach into a conclusion whether it is Vata predominant or Pitta predominant or Vata Kapha predominant or Vata Pitta predominant. Like that, based on the number of Lakshanas, you can reach into a clear-cut conclusion regarding the dosha involved. Okay. Then the systematic physical examination of various systems, integumentary system also should be recorded. Okay. So these are the basic recording. So regarding the integumentary system examinations, primary lesions where it is found and size of the lesion and border or demarcation of the lesion, color of the lesion, then distribution, whether it is distributed all over the body or to a localized part or symmetrically distributed, like that. All those things should be recorded. Then shape of the lesion, whether it is round in shape or the patches are joined together or single patches there or macule, papule. I think these things are already discussed by some other teachers, some other doctors in the previous classes. So I'm not going to detail into that. So these things should be recorded. Symmetry, then swelling, then also observe for the nails. Then palpation, the induration of the skin should be taken. Tenderness of the area, the temperature of the area, and texture of the area should be recorded. Then PASI, whatever outcome measures we are planning to record, that should be recorded before treatment and also after treatment, like PASI, DLQA, Dermatological Life Quality Index, and pruritus scale, then Candle sign, auspice sign, all these Kobner phenomena, all these things will be recorded. Okay. So then we reach into the conclusion that the particular condition is a predominant which dosha and what may be the diagnosis and what are the primary nidanas for the position of that particular disease. Okay, then concomitant medication, any of the medications they are taking, that should be recorded, and whether to continue or not, that decision should be taken. Then we should get the consent of the patient. Okay, so at the first itself, if you take the consent, that will be easy for you because at the end you need not to go behind the patient for getting consent for the publications. Okay, so take all these informations at the first itself, take the photograph before treatment, record the outcome measures, then treat the patient. Okay, so while recording, you should be confident enough that this patient is going to cure. Keeping in this mind, you record. Then, if it is failure, that also you record at the end, because this treatment was not successful and the case was a failure. Patient discontinued the treatment. Whatever it may be, you record that, because that is also very important information. The failures also can be published. Okay. Then Snehapana, etc., etc., etc. I am not going to do that. Snehapana assessment. So coming to the PASI recording, there are mainly arrhythmia, induration, scaling, These are the things seen in the PASI scoring. So head, upper limb, trunk, and lower limb. The body will be divided into four: head, upper limb, lower, and trunk, and lower limb. So we should give the score for these different parts for the erythema and for induration and for scaling. Erythema, induration is nothing but the thickness of the skin. Then scaling. Scaling means the place which is scaling out from the body surface. Okay, the 0 to 4 score should be recorded. 0 means 0, none, no erythema or no induration or no scaling in the head. And slight scaling or slight induration or slight erythema is the good 1. And moderate 2. Severe scaling 3. Severe, very severe scaling 4. So like that, for each and every body part, like head, you should give the scores for each 3 symptoms. For upper limb, give the score. For trunk, give the score. For lower limb, give the score for erythema, induration, and scaling. So like that, before treatment, after treatment, we have to. So calculate the lesion score and calculate the area score and subtotal, and finally total PASI score will be calculated. Then coming to the third table, you can see how area score is calculated. 0 means 0%, and 1 means 1 to 9%, 2 means 10 to 29%, 3 means 30 to 49%, 4 means 50 to 69% area score, and 5 means the score which is given in the total score. If it is lesion score, if it is 5, then 70 to 89%. If it is 6, 90 to 100%. Like that, area score will be calculated. Multiply lesion score, that is A, by area score, that is B, for each body region to give 4 individual subtotals. So that is the C. So multiplying lesion score with area score will give the subtotal. That is C. Okay. And subtotal, multiply each of the subtotals C by amount of body surface area represented by that region. That is 0.1 for head into 0.2 for upper body into 0.3 for trunk and into 0.4 for lower body. So like that, if you multiply the subtotals, you will get the total score of D. So this final score will be considered as the PASI score. Okay. So this is manually done. Nowadays, some online tools are available. You just give the numbers like erythema, how much score for head, trunk, upper limb, trunk, and lower limb. You will get the final PASI score. Okay. So that is also possible. PASI means psoriasis area severity index. Then coming to the DLQI. DLQI, why it is important means, even though the PASI shows 0, the patient's mental status or his social involvement, all these things will be affected because of the disease. Even though it is cured, he will not be back to normal. So to understand this quality of life of this particular patient, we should record the dermatology life quality index. So life quality index can be disease specific. In many diseases, you will get the life quality index. But this is a particular questionnaire for the dermatology life quality index. Okay. There are 10 number score sheets, 10 number question sheet is there. So over the last week, how itchy, sore, painful, or stinging was your skin been? So very much will be the answer, or a lot will be there, a little, not at all. So initially, whenever we record, it will be very much or a lot. But if the treatment was success, at the end after treatment, it will be not at all. Like that, each and every question should be answered by the patient. And if it is not relevant, you can write as not relevant. Okay, so the scores are like this. If it is very much, the score will be 3. A lot means score will be 2. A little means score will be 1. Not at all, score is 0. Not relevant also, score is 0. Question 7, exclusively for question 7, prevented work or studying. Prevented, there are 2 questions are there. If it is related with prevent work or studying, the score will be 3. Like that, the total sum of this score is considered as the score of the DLQI. If the score is 0 to 1, no effect at all on patient's life. If it is 2 to 5, small effect on patient's life. The disease having some effect on patient's life. It is 6 to 10, moderate effect on patient's life. If it is 11 to 20, very large effect on patient's life. If it is 21 to 30, the total score, extremely large effect on patient's life. Okay, so initially there will be moderate to extreme effect on the patient's life if it's a severe condition of skin disease. But after the treatment, if the treatment was success, it will come to 2 or 0 score. Okay, so this also freely available on the website. Similarly, depending on the disease, we need to select various tools. For that, you need to regularly update your knowledge by reading the published research article or case reports in the journals. Okay, because nowadays it's easy to get the journals in everything is in your fingertip. Okay, pruritus severity scale. So regarding the itching is a subjective feeling, right? So it cannot be measured with some instrument. So that is why this tool is very important. How often did you feel pruritus within the last 3 days? There are 3 answers will be there, and accordingly the scores also will be given 1 to 3. How in the second question, how did pruritus hinder your ability to do simple things like watching TV, hearing music, etc.? Yes or no? If it is yes, 1 point. If it is no, 0. So like that, the total score can be recorded. Okay. So how from the total score, how much it is reduced after the treatment is the shows the efficacy of the treatment in pruritus. Okay. This is 12 item pruritus severity scale. Okay. So before we use any of these kind of tools for outcome measure, you should ensure that they are officially released by some of the research institute or properly validated tools. Then only you have to use that. Otherwise, it will not be accepted by any journals for the publication. Okay. And going back to the VAS visual analog scale for the pain or even for the tenderness, etc. You can record. Visual analog scale, majority of you may be aware that a 1 to 10 number you have to put and ask the patient to record how much is your pain. 1 is minimum or 0 is no pain, 1 is minimum and 10 is high pain. You just record how much is your pain. They will record it 5, 6 or 7. Like that, the patient can record because the pain is also a subjective feeling. Because the same pain may not be. For example, if you prick your skin with a needle and some other your friend, the pain perceived by yourself and your friend will not be the same. The grade of pain will be different depending on the threshold or the perception of each and every individual. So that is why it is very much subjective, the pain sensation. So we need such tools to assess the pain. Okay. Coming to the publications, I am not going to detail into many publications. I will give some simple examples how you have to search the internet for getting good publications. Of course, for getting good publication, always you have to go for PubMed, either PubMed or to the Scopus site. You just Google PubMed. So directly you can go to the PubMed indexed articles, and there you can give the search as Ayurveda and skin, Kitipa management of Vispota Kushta, like that. Some search you have to give. Then you will get the relevant articles related to that your search. So this is an interesting article published by not by Ayurvedic doctors, but it relates to the Ayurveda. So that's why I want to show this. This is a result of interdisciplinary research. Not interdisciplinary, it is transdisciplinary research. This is the outcome of such a study. So where understanding the association between the human gut, oral and skin, human gut, oral and skin microbiome, gut microbiome, oral microbiome, and skin microbiome, and the Ayurvedic concept of Prakriti. So they are trying to identify some association or relation between the skin microbiome and Prakriti, or gut microbiome and Prakriti, or oral microbiome, and based on Ayurvedic Prakriti body types. Okay, so human microbiome, because the microbiome is nowadays a very much fascinating terminology in the medical research, because each and every thing will be related to the microbiome, either for the development of identification of disease or for the treatments, whatever it may be. The researchers now trying to relate it with the microbiome. Human microbiome is considered the latest discovered human organ, and microbiome research reiterates the fundamental principles of Ayurveda for creating a healthy gut environment by maintaining the individual specific microbiome. Hence, it is important to understand the association of human microbiome with the Ayurvedic Prakriti of individuals. So that is why they have planned this study. This study was done in Pune. The last author, Yogesh Sochi, is one of the leading microbiome researcher from the National Institute of Microbiome Research in Pune, situated in Pune, and he is the PI, or the leading investigator for the National Microbiome Project. Okay, so very reputed scientist. And here, what they have done is they have taken the microbiome samples from gut, oral, and skin of healthy individuals, 18 by 16S RNA gene-based metagenomics using standard QIIME pipeline. In the 3 different Prakriti samples, differentiated abundance of bacterioids, Diphtheria, parabacterioids, Salachia, and Succinovibrio was observed in the gut microbiome. Analysis also revealed Prakriti-specific presence of gut Mogi bacterium, etc. are also seen. So, in the Kapha Prakriti individuals, the Carnobacterium, Rogigenitalia, Cetobacterium, Phycrobacter in the Vata Prakriti individual. So, Prakriti specific the microbiomes they could identify. So, that is very interesting to see. So, in the skin also, the skin specific microbiomes are very much specific to the Prakriti also, the involved dosha behind it. Okay, in summary, they say that human gut, oral and skin microbiome showed presence of high abundance of few bacterial taxa across 3 Prakriti types, suggesting their specific physiological importance over the skin. Okay, so this is in healthy individuals. So, of course, if it is seen in the healthy individuals, we can establish the same relation of gut microbiome related to the Prakriti in a disease condition also. Okay. Similarly, another interesting article related with the dermatology is integrating modern dermatology and Ayurveda in the treatment of vitiligo and lymphedema in India. This is published by Institute of Applied Dermatology in Kasaragod, Dr. Sarau Narahari and Guru Prasad Akitaya. It's an integrative center for dermatology situated in Kasaragod, and Dr. Narahari is one of my mentor, and Dr. Guru Prasad is one of my friend. So they have done extensive work in the integrative dermatology, integrating Ayurveda and modern medicine. Okay. So this is also you can go through. The detailed paper will be available in the internet. So this is an abstract of the study. Globally, governments have recognized the growing popularity of complementary and alternative medicine and the possibility of their combined use with the biomedicine. Decisions within the government of India have led to a conducive environment for conducting clinical studies to achieve integration of more than one system of medicine, so that their combined benefits can be brought to bear on chronic, difficult to treat conditions. Okay, so they have integrated dermatology, modern dermatology, Ayurveda, and yoga therapy, and also homeopathy. Okay, 638 patients affected by lower limb lymphedema requiring skincare as a major part of treatment were treated, integrating modern dermatology and Ayurveda. Okay, the result shows very much encouraging. In the statistical analysis showed that average volume reduction. The lymphedema is the elephantiasis. So the sleepada in Ayurveda it is called. The volume of the leg is measured as a outcome measure. The volume of average volume reduction in the lymphedema is in 13.3% and 23% on day 14 and 19.7% and 31.1% on day 45 and 23.4% of volume reduction and 39.7% on day 90 of treatment in small and large lymphodematous limbs. Inflammatory episodes before the onset on this treatment was reported by 79.5% of our lymphedema patients and 9.5% reported this at the end of 3 months after our treatment. So there was a drastic reduction. Among vitiligo patients, they found that 39.6% of patients had kapha, 39.8% had pitta, and 10.8% had vata, and 0.52% has tridosha presentation. There are over 100 treatment options available in Ayurveda to treat vitiligo. Discussion. Each system of medicine recognizes the same disease a bit with minor difference in description. Skincare procedures like washing and emollients restore the barrier function and skin health. We have converged Ayurveda skincare with that of dermatology with an aim of achieving patient management that is better than that achievable by a single system alone. Overload of lymphatic system due to loss of epidermal barrier function and consequent inflammation from bacteria and soil irritants is responsive to selected Ayurvedic herbal preparations. So conclusion is very interesting. It is evident that integration at the therapeutic level is possible. It is possible to integrate modern therapeutic along with the Ayurvedic therapy, although the pathological basis is interpreted differently. The symptoms will be same, the patient is same, but the pathological basis is interpreted in different way. We interpret it in dosha basis, they interpret it in some other way. Irrespective of background, understanding of the given disease, a mutually oriented multi-system therapeutic team was able to effectively use medicines from more than one system of medicine and to develop guidelines for their prescription and a patient care algorithm. Okay, so this was a very interesting study, integration of Ayurveda dermatology along with the modern dermatology. Okay, coming to sample case reports, I will take you to one of my papers, which is